Hi, my name is Jessica Tapusoa. I'm a nurse here at AesthetiCare, and Audra is here with me today so we can show you what the CoolSculpting experience looks like. We've already consulted. Audra's actually already had a treatment done before. However, we have never treated her abdomen. So I'm going to walk you step through step what we do during the CoolSculpt treatment so you can see how this is done. First thing we do is we have you come in. We are going to have you change into an outfit that we'll give you to keep you from getting your clothes messy. We take pictures with a very thorough medical grade photography system. We'll do a complete body measurement scale that breaks down everything in your body from fat to water to muscle, and then we get you prepped for the treatment. In the preparation, I'm going to mark the patient. This is something that has already been decided through consultation as far as which applicator I'm going to use and what area of the body we are treating. Today, we are going to treat Miss Audra's lower abdomen. As you notice, we have templates that we use that mock the size and shape of our applicators. Audra's main area of concern here is the lower abdomen. She has had children, and we have a nice little C-section scar that is causing what we like to call a shelf. So, in other words, the fat just kind of sits on top of that scar. Now, CoolSculpting is such a popular option for small pockets of fat because it permanently kills the fat cell. This isn't something that just temporarily makes the fat cell look smaller. It literally crystallizes, freezes, and kills the cell. Once a fat cell is killed, it is gone forever. All CoolSculpting is literally controlled temperature. We don't inject any kind of solution into the body. I don't have to numb you. I don't have to drug you. Obviously, there is no cutting, so it is considered non-surgical. I don't have to stick her with any kind of needle. Now that I have her marked, I have our gel pad here. This just kind of helps to serve as a lubrication for the suction of the applicator. I have my machine right here behind me. Again, this was all pre-decided as far as which applicator and which shape I was going to use. I wanted to point out, though, the importance of the applicator. We have all of the upgraded equipment here at AesthetiCare when it comes to CoolSculpting because there is such a thing as first-generation CoolSculpting. About 3 to 4 years ago, they upgraded their applicators mainly for comfort purposes, but luckily for us, it eliminated a lot of the side effects that you may have read about or seen on the internet. The inside of the applicator is the cooling panel. The cooling panel here is what is able to appropriately get the target tissue that we're treating to the temperature we know it's cold enough to kill the fat, but it's not so cold it's going to kill or damage the skin. Subcutaneous fat, which is fat that lies above the muscle, dies at a higher temperature than what we freeze skin at. Therefore, we don't have to worry about frostbite. So to carry on with the treatment, I just want to show you. I'm going to prep my machine here. Select the area. Depending on which applicator we use, that depends, or that decides how much time each treatment is. The larger applicator that we're using today with Audra is 45 minutes long. All right, Audra, first I'm just going to attach the applicator using suction. Okay, here we go. Breathe normal for me. All right. How does that feel?
Great.
We use the boppy pillow here just for a little support on the applicator. I'm going to adjust everything just to make sure she's comfortable and that my applicator is well supported. Now I'm going to start the cold. Now you feel the cold pretty quick. The good news about this treatment is after about 5 to 7 minutes of feeling cold in that localized area, you do go numb. So in a real treatment, when you are over across our hall here at AC Body, we have big screen TVs on the wall, so you're able to watch TV, you can watch Netflix, Prime Video. I have people that will bring computers and work. We do have Wi-Fi to make that happen. You can be on your cell phone. I even have patients that take naps, so it is a very relaxing treatment. If for any reason Audra needed me during the treatment, she has a call button. She would push her button, it would notify me, I have a pager, I would come back, be there within 2 seconds. So as far as the treatment goes, it's a very comfortable treatment. Now, Important things to remember: there is no downtime with this treatment and there is no restrictions. So once Audra is done here, in theory, she could leave here and go straight to the gym. Realistically, what to expect with CoolSculpting: immediately post-treatment, you may be a little numb in the areas that we treat. You also might be a little tender in the areas that we treat. This isn't anything, though, that would keep you from doing your normal routine. If you are sore, or maybe more sore than you want to be, compression garments can help with comfort purposes. They will not give you a better or worse result, however, it can help it feel a little less intense. So post-treatment, Audra is going to go about her business, play with the kids, not going to make you sun sensitive so you can still be outside. Again, you can work out, you're going to sleep fine, you're going to work, you're going to do everything you would normally do. Results can start to show as soon as 3 weeks. This is something that will continue to improve, just like with almost everything we do here at AesthetiCare, for up to 3 to 4 months. We generally like to have our patients come in about 8 weeks post. We'll do a second set of pictures. You'll notice a whole array of our before and after pictures on our website, but we like to see a side-by-side comparison as far as results that we're seeing so far. Generally speaking, we recommend at least 2 treatments in a cosmetic zone, meaning in the area, to get desired results. However, it is possible to do 1 treatment and get a nice change. So we leave our expectations up to the patient's expectations. When she's happy, when our patient's happy, that's when we're happy. So whether it's 1 treatment, 2 treatments, 3 treatments, so on. Now, just because we use this applicator in this area this time doesn't mean we're necessarily going to use the same one next time. Whether it's sculpting, debulking, whatever the area may be, we have the perfect applicator for the size and shape of the area. There is no prep involved with CoolSculpting. She came in as is and she will leave as is in her clothes. So again, we just kind of track everything. It's totally safe to retreat if we do know we want to do multiple treatments as soon as 30 days. Here at AesthetiCare, we are the #4 clinic in the whole country when it comes to CoolSculpting. We have a great team of technicians who all do the treatment, and we have 4 machines, so it's generally pretty easy to get in and on our schedule for a treatment. Also here at AesthetiCare, we like to do an additional protocol we refer to as ZWave. After Audra's done here and I remove the applicator after a solid 45 minutes, what she's going to experience is crystallized fat cells. It almost kind of looks like a fat popsicle, okay? She's going to be a little pink, she's going to be cold to the touch obviously, and it's going to be pretty firm. Traditional protocol and what most offices across the country do is they have their technicians manually massage the area out with their hands. It's almost like you're kneading dough. They would do that for a total of 3 minutes. We used to do it that way. It's very uncomfortable for the patient and it's not very much fun for the technician because it is so cold. A few years ago, we discovered an additional protocol called ZWave. ZWave is made by Zimmer. It's a handheld acoustic device that actually is almost like a handheld little jackhammer. The vibration waves that ZWave puts off are on such a specific level that it's able to break up more crystallized fat than what I could do with my hands. It is literally just vibration. Very hard, very fast. There's no energy to it, it's not a laser. We still do that for about 2 to 3 minutes post-treatment. However, like I mentioned before, it's able to help further cell death, helps with the post-inflammatic response, meaning you may not be as swollen as you could have been, and it's more comfortable for the patient and for me. Now, we don't charge anything extra for this. This is just something that we have learned that improves results and it improves client comfortability. After the ZWave, clean up the patient, she would change, and literally that's the whole treatment. So if you have stubborn fat that won't respond to diet and exercise, I highly recommend you calling our office and getting on the schedule with one of our very experienced technicians so we can get you on your way to your CoolSculpting results. So now I want you guys to hear from Audra herself as far as what the treatment itself feels like. Audra, can you kind of explain from the minute I put it on, did it feel pinchy? Did it feel, just walk us through it. How did it feel?
Sure. No, there was no pain or anything. It just a little bit of suction, and now I'm just relaxing, a little mommy break.
So during the treatment, especially since you've had this done before, the first few minutes you feel the cold. Just kind of hang out, like you said, kind of get a little vacation from the kids. You get to relax. We have refreshments, by the way. Watch a movie, just kind of sit here and hang out. When we take the applicator off, since you have done this before, can you kind of tell us what that feels like too?
Yeah, there was no pain or anything when she removed it, and the rest of the day I just felt it was firmer and maybe a little bit tender, but not painful at all.
Sure. Bruising, swelling, anything
Nope.
like that?
Didn't have any of that.
Bruising's always a possibility. We don't anticipate it, but it can happen. We just want to mentally prepare everybody for that. Now, since the treatment is over here, I want to show you guys exactly what the ZWave looks like. I'm going to prepare Audra and take the applicator off. You'll notice she's a little pink. It's going to be very cold. Very slowly. I'm going to remove the gel pad here. Again, the ZWave is nothing more than vibration. It's very aggressive. And we use this just to break up that crystallized fat that we've created using the cold. All right, Audra, this is going to sound like a jackhammer, okay? It's going to be kind of loud. I don't want to scare you. Is there any pain with this?
Not at all.
I'm slowly just going over the area to ensure that we break up all of that fat that we just grew. All right, that's simple. Now, after Audra leaves here, the breakdown of the dead fat starts, okay? A lot of people ask, what happens to that fat once it's frozen? Your body's trash system, if you will carry it off, and it is processed through the kidneys and liver. You eventually excrete it out just like you would any other waste in your body. Now, there have been multiple clinical studies done to prove not only the efficacy of this treatment, but also the safety of this treatment. So it's not going to throw your organs, your kidneys, your liver, anything into overdrive, and it's not going to elevate or change any levels as well. As far as the breakdown goes, she will not even know this is happening. Realistically, the swelling and the bruising, those are things that can always happen. Again, doesn't happen very often. The numbness and the tenderness, we do expect that. Once that's over, she'll probably forget she had anything done. Again, you can start to notice changes as soon as 3 weeks. At 4 months, we know it's as good as it's going to get. We'll come up and have you come back about 8 weeks post, come up with a game plan from there and see what we're going to do. So as far as CoolSculpting, it couldn't be easier to kill those small pockets of fat that bother you and that don't respond to diet and exercise.